And I'm joined now by Dr. Daniel Drucker. He's a senior scientist at Lunefeld Tenenbaum Research Institute at Mount Sinai Hospital in Toronto. Thank you very much for taking the time to speak to us today. Right, Doctor, so before we jump right in, how would you describe the current landscape of anti-obesity drugs around the world?
So we've gone from decades where nothing really worked to now having two very exciting medicines, semaglutide and tirzepatide, that are now allowing people to achieve 15 to 20% weight loss. So this is a new era for pharmacotherapy, but around the world, there's a shortage of the medicine. So it'll take some time till the medicines really have a global impact.
Right, and we'll speak about the shortage as well in a minute, but I'd like to ask you as well, how is the competition between Eli Lilly and Novo Nordisk, the famous maker of drug Ozempic, going to play out?
So they are continuously going to be trying to improve their medicine. So right now it looks like tirzepatide is more effective than semaglutide, but there are higher doses of semaglutide being tested. There are combinations with semaglutide that look like they're going to be extremely effective. And Lilly has new versions of molecules. So I think you're going to see a continuous race to improve the medicines that will benefit people living with these diseases.
And do you think there's any other promising newcomers to the sectors as well?
So there are a lot of promising newcomers. We have exciting drugs from Boehringer Ingelheim and Zealand in phase 3. We have very exciting medicines from Amgen in phase 2 clinical trials. We have oral small molecules that will allow people to take a pill once a day to achieve the benefits, and many others. So this is going to be a very crowded race to continually improve the results we can obtain.
Right, and as you hinted at a few minutes ago, there appears to be a shortage of diabetes drugs. We also know that certain celebrities are using it for weight loss purposes, but actual diabetes sufferers are in need of the drug. Both Novo Nordisk and Eli Lilly expect a shortage throughout 2024. What can be done?
So I think what we need to do is limit the prescriptions to people with the most serious conditions. So one should be able to prove that one has living with type 2 diabetes or living with obesity, and perhaps under extreme circumstances, one also is living with heart disease, where these drugs are known to save lives and reduce heart attacks, strokes, and deaths. So it's unfortunate, but we must make sure that we prioritize the supply of these medicines to the people who would most benefit.
Right, and just before I let you go, one last question. Given that obesity is such a relevant risk factor for health in general, do we expect that a wider use of anti-obesity drugs will improve the overall health in the US, but also globally? Can this lead to an overall reduction in healthcare costs?
So I think we're at the very beginning of this chapter, and right now the drugs are very expensive and they're not widely available, but it's an excellent question for public health. If the drugs were less expensive and more widely available, we would see a meaningful impact on health, probably a reduction of healthcare expenditures, and probably an increase in longevity. But it's early days and there's a lot more work to do.